Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about the upside of change, specifically the upside of the shift from volume to value from a physician perspective. It may be hard to see an upside of value-based payment for physicians at first. For one thing, it will turn the business model for some physicians upside down. For another, physicians will have to change the way they practice medicine and spend more time with their patients. In this scenario, the downside is also the upside. Physicians will get to spend more quality time with their patients, and that in itself will go a long way toward reducing physician burnout. That's a good question. Less than a third of a physician's time is actually spent with patients, according to a recent study. Almost half of their time is spent on electronic health records and desk work, paperwork, data entry, insurance hassles, regulatory compliance, and so forth. That is not why physicians went into medicine. I often hear stories about physicians logging in for hours from home simply to keep up with all these required processes, and none of that is quality time. When physicians spend one-on-one time with patients to help them manage their chronic conditions, to get a better sense of their lives outside of the doctor's office and how their living situation impacts their health, to work in partnership with their patients, that is quality time. That's time well spent. It fights burnout and contributes to high-value healthcare. And that's why some members of HFMA's Physician Editorial Advisory Board believe that value-based care can eventually increase physician satisfaction. Well, physicians may be a little skeptical. A recent study found that more than 60% of physicians expect high-quality care delivery to get harder in the next couple of years, not easier. They cited familiar issues like regulations, administrative work, and the hassles of implementing EHRs as the reasons why. Simply put, they are pretty darn skeptical. And that's understandable because it seems like all we've done is add to their administrative burden over the past 20 years. To engage physicians and fight burnout, healthcare leaders will need to look at these issues with fresh eyes. EHRs are a tool for achieving high-value healthcare, not just a way to earn meaningful use incentives, and definitely not an end in themselves. The regulatory environment should be monitored and assessed on an ongoing basis. When regulations don't improve value, healthcare stakeholders should work toward changing them. This is exactly what HFMA seeks to do through comment letters and consulting with federal agencies on a regular basis. On an organizational level, administrative tasks should be re-evaluated to ensure that they support high-value care. To that end, your input to us, as members dealing with this environment, is invaluable. So here's the deal. Physicians and finance leaders routinely work together on many issues, and that's good. It builds collaboration muscles. But at the same time, it's important to recognize that many of these issues are just intermediate steps on the journey to high-value healthcare. The journey is long, and it's easy to miss the forest for the trees. Healthcare leaders need to look at these value-based process issues through a physician's eyes in addition to seeing them through consumers' eyes. In seeking to spend more quality time with their patients, physicians are naturally gravitating toward high-value healthcare. Finance and other healthcare leaders should recognize that and look for ways to support it. Thanks for watching. I'll see you next month.